Jefferson Comprehensive Care System Incorporated was established in 1972 under the leadership of Larnell Davis to provide comprehensive health services in medically underserved areas in urban and rural Arkansas. What began as one medical and one dental center in Pine Bluff has expanded to include the Alzheimer Clinic, Redfield Center, College Station Clinic, Risen Center, the Homeless Open Hands Center, and Little Rock Community Health Center for a total of 7 delivery points. In 1993, Medical Director Dr. Henry Masters recognized an emerging trend of HIV cases in rural Arkansas. He approached Executive Director Larnell Davis about applying for the Part C Special Projects of National Significance grant through the Ryan White Care Act. They were funded, and the Special Programs Division of JCCSI had begun. The Part C program, it has and continues to be the pillar for HIV treatment in Southeast and Central Arkansas. The mission is to provide comprehensive, quality healthcare services that are readily accessible to persons living with HIV/AIDS. The goals: increase accessibility of early intervention services, provide comprehensive, coordinated primary HIV medical care, provide continuous quality improvement activities, and provide consumer involvement activities. We evaluate the programs through the use of CQI activities. Jefferson Comprehensive Care System celebrates its accomplishments, shares lessons learned, addresses its challenges, and identifies areas of improvement during National Healthcare Quality Week annually. One accomplishment is that 92% of clients were prescribed highly active antiretroviral therapy. Together, we are making a difference as we continuously strive to improve clinical outcomes. JCCSI realized a need for the Part D grant and was funded in 1999 to provide HIV services to women and families. Since then, the program has grown to provide care to 243 infected and affected clients. The program goals are to link clients to HIV care, reduce mother-to-child transmission, educate clients about clinical research, and eliminate barriers to care. Program highlights have included summer retreats for clients that show high compliancy in program services. Part D is committed to disseminating factual information throughout the state. Examples of our efforts include regional HIV conferences, which were held every 3 years, HIV billboard campaigns that feature leaders such as former Surgeon General Dr. Joycelyn Elders and current Health Director Dr. Paul Halverson. Additionally, we reach youth through the Sisters Talk campaign. Routine HIV testing at HBCUs began in 2005. In 2006, JCCSI partnered with Philander Smith College and offered an HIV testing party where students were admitted free after receiving an HIV test. 250 students were tested and received a t-shirt that read, "I know, do you?" meaning I know my HIV status. Do you know yours? Radio commercials promoting HIV testing were also developed to encourage free HIV testing.
Parties take a free HIV test. Plus, you'll get a free t-shirt. HIV is a serious problem, so come on out.
The Part F program, also known as the AIDS Education and Training Center, has been housed at Jefferson Comprehensive Care System since 1998. The mission is to improve the quality of life of patients living with HIV/AIDS through the provision of high-quality professional education and training. Training is targeted to providers who serve minority populations, the homeless, rural communities, incarcerated persons, community and migrant health centers, and Ryan White Care Act-funded sites. We focus on training a diverse group of clinicians, including physicians, advanced practice nurses, physician assistants, nurses, oral health professionals, and pharmacists. Training activities are interactive, with clinical consultation to assist providers with complex issues related to the management of highly active antiretroviral therapy. Since 2001, the Arkansas AETC program has sponsored more than 2,000 training interactions for providers in Arkansas. Clinicians trained by AETCs have been shown to be more competent with regard to HIV issues and more willing to treat persons living with HIV than any other primary care providers. In 2003, JCCSI became the pilot project for the CDC's Healthy Relationship Intervention, also known as HR. Our mission is to empower individuals living with HIV/AIDS to make positive choices that will reduce stress factors. HR is a 5-session group intervention with men and women living with HIV/AIDS and is based on the social cognitive theory, which states that persons learn by observing others successfully practice a new behavior. In order for persons to successfully change their behavior, they need information, self-efficacy, outcome expectations, social skills, self-regulating skills, and reinforced values. As of December 2009, JCCSI has enrolled 350 clients into the program, and 91% have reported significant behavioral changes. Additionally, we received other funding for prevention, which allowed us to reach diverse populations throughout the community. Examples include Many Men, Many Voices for African American, gay, bisexual men of color. The community-based Outcome Monitoring Project was utilized to evaluate the behavioral changes of HR. And finally, the Cable Positive's Tony Cox HIV Awareness Commercial Campaign was funded to encourage HIV testing and awareness. In all that we do, we are empowering people to make positive choices. SAHMSA. In 2007, JCCSI was awarded a grant from Substance Abuse and Mental Health Service Administration for 5 years. Our mission is to establish a high-quality outreach and pre-treatment program for substance abusers by providing linkages to healthcare services. In year 1, our goal was to provide outreach and pre-treatment services to 400 clients and 75 GPRA interviews. We exceeded these goals by providing services to 1,950 individuals. The integration of outreach and pre-treatment services within an existing continuum of healthcare services provided by JCCSI linked 24 clients testing positive into care. In year 2, our goal was to have the SAHMSA team continue with the target effective outreach services to 440 clients and 440 pre-treatment services for African American and Latino substance abusers. All of these goals were also exceeded. Lastly, in the previous 2 years, 200 substance abusers received assistance into treatment. Out of the 4,121 individuals who received an HIV test, 121 tested positive, and 98% of those are now receiving medical care. The Special Programs Division, comprised of Part C, Part D, Part F, HR, and SAHMSA, are doing extraordinary things together to serve the HIV community right here in Arkansas.